This is the Emergency Medical Minute, sponsored by CarePoint and HCA Health One.
Summer brings a lot of fun injuries and injury patterns that we typically don't see in colder months. And so one of them we saw a couple of weeks ago out in D-Pod. And that is this young kid who came in after hooking himself with his own fish hook. And so fish hook foreign bodies, I guess you could see them in the winter if you had like ice fishermen who would get impaled, but we certainly probably see more of these in the summer. There are a handful of ways to get these out, and so we'll go over those today. The first thing, so kind of how this happened, this kid is like 18, 19 years old. He's fishing on the side of a little creek in Denver. His buddy stands up pretty quickly and knocks over his tackle box, and he puts his arm out to prevent it from falling in the river, and he just gets stuck with like a ton of these fish hooks. It like knocks over, and he like catches like the basket and a lot of them in his arm. And so the first thing is, you know who's really good at removing fish hooks are people who fish. And so I would say almost all of these fish hooks he was able to remove himself and just came in with these like little pockmarks. The one that really got stuck, I had to look it up, but it's called a spoon lure. And so it's a little bit bigger, and it sort of has this like trident looking thing. And at the end of it, it's double barb. And so this thing was like really embedded in the meat of his forearm. When you're considering removing these in the emergency department, kind of the first thing you want to make sure is that it's not next to any, crazy structures. One of the more common places for people to get hooked is actually in the face. If they're like casting, they can catch a friend or they can catch themselves. And those tend to be, you want to make sure that they're not really close to any important structures. Fish hooks in the eye, obviously those are going to the OR. So first thing is like make sure it's not next to anything that's going to require some additional friends. This guy wasn't, so it was in his forearm. And so then we're going to start talking about the techniques to remove this. So the first one, so I did my training in Los Angeles. We saw a lot of people who had taser barbs that were stuck in them when they were arrested by the police. And so this first technique is like really good for stuff that's superficial, and I think of like a taser barb for that. And that's called the string pull technique. So you want to get a piece of like 00 silk really wrapped around the end of that hook, and then kind of 1, 2, 3 and pull briskly up at a 90-degree angle. And for things that aren't super embedded, that works pretty well. That wasn't this guy, and so we're moving on to the other techniques. The second technique is snip the barb. And so if you have a fish hook that's all the way through, or it's almost all the way through and it's kind of tenting the skin on the other side, those barbs are really deeply embedded. You can push them all the way through. You can kind of snip the barb and then back it back out. This guy was very deeply embedded like that, but I guess I didn't know this, but like this was a nice lure, and this was something he didn't want ruined. And so he was like, if there's any way to save it, can you please give me back an intact lure? So I was like, all right, we'll try. So we skipped that one. The next one is called a needle cover technique, where you would actually put a needle in and sort of cover up the barb and then try and back them both out together. People who work at fishing communities have reported good success with this. I've never tried it. It seems sort of like a stabbing in the dark to find the right spot. But what I will say is that once you are not successful with your string pull technique, all of these do really well with a little bit of hydrodissection. So think about pulling out like a big splinter or something like that. You can actually take a needle and go along the track of the hook itself and put your lidocaine sort of along the track. And that works in two ways. One, it sort of numbs them up. But the other way is that it sort of actually creates some edema in that tissue, or sort of spaces out those tissues enough that you can probably get a much better retraction on it. We inject a bit of lidocaine, we pull it back out, and we sort of get stuck on the underneath side of the skin on the last barb. And I'll say that's pretty common. The barbs kind of, you can, especially once you hydrodissect, you can usually get them out pretty far, but it's sort of getting stuck on the underneath side of the skin. And so at that point, you're doing an incision. So you can make a small incision with an 11 blade. You've already numbed that area pretty well, and that usually gives you enough space to back the needle out, or back the hook out all of the way. We aren't in a marine community, but if you were close to the ocean, you might think about antibiosing these patients. A lot of times I'll say, I haven't seen too many fish hooks that have been in the fish and then in the person. They tend to be clean fish hooks that people impale themselves with. And so there's not really great evidence that you need to like prophylactic. This isn't like a dog bite or something where you need to like prophylactically antibiotics all these people. But if you had somebody who was really immunosuppressed, or it was a particularly dirty wound, that's something you might consider.
This has been the Emergency Medical Minute. Thank you to our sponsors CarePoint and HCA Health One. Support from them and listeners like you helps us to continue providing free medical education to the masses. If you found this episode valuable, consider supporting our work and check out the link in our show notes.